Get started. Thank you so much for joining us today. We're very happy to talk to you about a course that we created and taught actually last summer that covered public health, physical activity, urban mobility, and the built environment. And with that, I'll turn it over to Dan to say a few words about himself.
Thanks, Jeff, and welcome everybody. So glad you could join us. My name is Dan Bornstein, and I'm an associate professor in our Department of Health and Human Performance here at the Citadel. My background basically is in exercise science, but with an emphasis on physical activity and public health and policy systems and environmental changes. And I'm also the director of a center here that is a multidisciplinary collaborative center that's designed to bring together fields of public health, exercise science, and actually in national security. And while I was finishing my PhD at University of South Carolina, I had a collaborator whom some of you may know, named Kelly Evenson, who is at UNC Chapel Hill, and she and I were working on some projects together. And when I let her know that I was taking a job at the Citadel, she immediately said, you got to meet Jeff Davis. He's awesome. He's a civil engineer, but he's really into bicycle and active transportation, and you got to get in touch with him. So I before I even completed my PhD, I sent Jeff an email, and ever since then, we've really enjoyed spending time together and trying to work together. And this is one of the projects that we've been able to work on, and we're really pleased to be able to share with you what we've learned in efforts to try to influence the various fields in which we operate. So thanks for joining again.
Yeah.
Jeff.
Thanks, Dan. So I'm William Davis, but I go by Jeff, and I'm a head of the Civil, Environmental, and Construction Engineering Department at the Citadel. My background is in transportation engineering, and was really happy to be able to collaborate in this manner on this project. We've had a number of collaborations, and you'll get to see this particular one today. Let me see how I advance the slides here. Find the right button. And it's been a critical aspect of this particular collaboration has been the consortium of the Stride universities, and with the University of Florida as the lead institution that provided us with, we wrote a proposal, and we had received funding to teach the course and develop the materials, but primarily to teach the course. And it's been great working in this consortium of universities, and they've been big supporters of this work through a lot of different discussions as we've developed the course, and now we're conducting a survey to find out what other courses have been taught similar to ours. And here is, so we have a group of people in South Carolina that come from Citadel, University of South Carolina, and the College of Charleston, about half transportation engineering faculty and half human health and human performance faculty. So this has been a great collaboration to try to get out of our silos and to have these conversations that help move these multidisciplinary ideas forward. And now to go over our objectives for the webinar today.
Yeah, so Jeff and I are going to take a little bit of a tag team approach here, which is precisely how we taught our class. So you'll see that as a theme. But first and foremost, we wanted to help you identify some of the challenges that exist in trying to bring together what are traditionally largely disparate fields of public health and physical activity. Oftentimes those get lumped together, but in fact they are in some ways and in many ways distinctly different fields. And then put on top of that transportation and land use, it can be a real challenge to bring those disparate fields together. So we'll help you identify what some of those inherent challenges are.
And then the main focus of our comments today are just about, well, what was the graduate course that we came up with, and what were the contents and how we developed it. But what we're really going to talk about today, probably more than anything else, is why. Why do we need to go forward move these ideas forward? Why is this needed in our professions and certainly needed in higher education? And then lastly, there were some lessons learned. We tried to bring together different disciplines, different fields, and we had some successes and things, and in some instances didn't work out quite the way that we had planned. And then if you have any questions or comments, you can put them in the chat box, and Dean is monitoring that and will help kind of prompt us to answer any questions that anyone has as we go along here.
Okay. So we know that we often operate in silos. And as I had said on that first slide, even within public health, there are silos. Within physical activity, there are silos. Within civil engineering, there are silos. So one of the great challenges we have is to really bring those fields together, to understand how traffic and crashes and sidewalks and planning and health and safety and these bigger words that you see here really all relate to each other, and they can impact one another. And there are dollars oftentimes that are available. We're going to talk a little bit later about the Transportation Reauthorization Act that's coming up. That's a federal initiative aimed at rebuilding our transportation infrastructure. And so how do we do that in such a way that we have a nice inclusive conversation about how to solve multiple problems from different perspectives? And we need to have those different perspectives represented when we're having these discussions, because we can really help each other and make a much bigger difference on the lives of people, which is ultimately, I think, what all of us are trying to do when we work together. And teamwork is certainly much better than going it alone. And working with Jeff certainly it demonstrates that. We've been able to do much more together than we ever could have alone. So that's really the why, is that we really do need to break down these silos so that we can identify opportunities to collaborate and solve problems that exist across different disciplines.
And my introduction to this whole area really came through the Robert Wood Johnson funding of active living by design and active living research, where I've come to find out, to come to learn that this research has been done by parallel professions, and they begin to conclude that urban sprawl and all the things that relate to the infrastructure are contributing causes to declining public health and rising healthcare costs in the United States. And this is a big call to action. These are things that are important to us all, and this is what really drew me into this back beginning, I guess, like in the early 2000s is when I became much more aware of the work that was going on in the public health profession.
So for those of you who are in the physical activity and public health space, this slide is going to be something that is not new to you, but what's important to recognize is what these maps show. So you've got different health outcomes and health behaviors that are represented on these maps. And what you see largely is that the South and Southeast are disproportionately burdensome in the fact that there are lower levels of physical activity, or higher levels of physical inactivity, if you want to say it the other way. And we know that those health outcomes like coronary artery disease, diabetes, certain cancers, obesity, are very much associated with physical activity or physical inactivity. And as we start thinking about even health disparities and health equity, which is very much a part of the conversation even today, as you're hearing it with COVID-19 and how it's disproportionately affecting certain segments of the population, it becomes important to think about where we may want to concentrate some of our efforts. And it may be that we want to concentrate those efforts in the Southeast. Jeff, maybe next slide.
I'm sorry.
Yep, that's fine. One of the challenges we have in the field of physical activity and public health is that I don't think there's anybody that thinks that physical activity is a bad idea. But oftentimes it's not perceived as a big enough problem to warrant the policy and systems and environmental changes that we know are necessary to ultimately influence individual level behavior. So the manner in which you frame the problem becomes very important. So if we look at just our state, the state of South Carolina, we see that 51% of adults fail to meet minimum physical activity standard, which is, to speak about it generally, 150 minutes per week of moderate intensity physical activity of any sort. But the majority of adults in the state of South Carolina do not meet even that minimum standard. Similarly, 77% of South Carolina youth failed to meet their minimum PA standard, which is a little bit different. That PA standard is 300 minutes per week. So we know that youth need more physical activity than adults do, but the percentage of those who fail to meet that standard is significantly higher in our youth population across the state. And again, that message may or may not resonate. So then maybe we talk about the health impact and the economic health impact. And so the cost of diabetes, treating it, is estimated at $5.4 billion annually across the state of South Carolina. And as we know, public health is largely about prevention. Again, if we're going to take lessons that we're learning from COVID-19, the old adage of an ounce of prevention is worth a pound of flesh, basically. The idea that we could have maybe spent some dollars up front to prevent some of what we're having now, as we're spending trillions and trillions of dollars to treat not only the health, but the economic impact that COVID is having. That's part of the idea here. And so finally, we look and see that heart disease, which is also very closely associated with physical activity, costs $3.2 billion annually, and obesity, $8.5 billion annually. So as we start talking to policymakers, sometimes if we can make the economic case, that may resonate. But sadly, oftentimes even the economic case doesn't resonate. And just a brief story about why that may not work, particularly at the federal level. When we start talking about physical activity interventions or things we may want to do, laws we may want to pass, complete streets policies, and so on and so forth. If we're looking at the health economic impact, oftentimes it's too distal. So it may take more than 5 or 10 years before we realize what that economic impact is. And if it's a federal bill, it's going to go before the Congressional Budget Office, and it's going to get a CBO score to see what the return on investment is. And if there's not a strong return on investment within 5 years, it's going to get a very low score from the CBO, and therefore it's going to be dead on arrival when it hits the floor of the Senate or the House. So the question then becomes, okay, if health is not a salient enough message to drive the policy, systems, and environmental change that we know is necessary, what other messages may work? So I've done some research looking at the impact that physical inactivity may have on national security, because there are very few lawmakers, I'm not sure I know of any lawmakers, particularly at the federal level, who aren't concerned about national security. And I did a study with the US Army where we looked at the rates of injuries and also rates of low fitness of basic trainees over a 3-year period of time to see if the hypothesis was that recruits coming from southeastern or southern states would be less physically fit and potentially more likely to become injured, which is a significant problem for the Department of Defense. So musculoskeletal injuries that are occurring during basic combat training in the military cost the DoD hundreds of millions of dollars. So we did this study, and in fact, this is what we found, that the same states that we know are disproportionately problematic for public health also pose a disproportionate threat to our national security, given that recruits coming from those states are less physically fit and more likely to get injured. So again, an opportunity to maybe reframe the message to make it a little bit more salient, hopefully, for policymakers.
And so this ties in obviously to our profession, engineering, transportation engineering, especially for the people who are registered as professional engineers. The responsibilities, the canons, the ethical canons, would say you don't just follow the standards of today, you have a much higher calling, and it's to hold paramount the safety, health, and welfare of the public. And this comes from all of our professional societies that would try to inform students and the profession itself as to how we should conduct work in our field. And beyond that, we're supposed to create a sustainable world and enhance the global quality of life according to the Vision 2025 from Civil Engineering, which is our parent professional society, and that's being updated today, and there'll be a new version of that soon. And so Dan framed the physical activity or physical inactivity problem statements, and then a lot of what we would begin to look at in our built environment have contributed to this. Zoning regulations, it's segregated land uses. What I would say is the worst invention in transportation history, from my personal beliefs, is the one-way in, one-way out cul-de-sac subdivisions, a fixation on single-family housing that adversely affects density, the zoning standards we have related to parking requirements for commercial and other types of institutional land uses, and then urban growth boundaries. I'll give you some numbers about Charleston, South Carolina. That's pretty surprising to me. And the annexation laws that have really made towns expand way beyond what is effective from a mobility standpoint. And we have a dependency on a single occupancy vehicle and lack of alternate modes. And we begin to see some of the metrics on the number of daily trips taken by personal vehicle, the number of short trips that are taken by car. And this is a real big targeted area for physical activity by maybe alternate modes or by walking. And obviously there's lots of measures that show travel times have increased. And we can't just widen roads all the time. You know, that's proving not to be effective, you know, overall strategy. We have difficulties with that. We had a big road widening project from 3 to 4 lanes. That was a $70 million project, relatively short section of road. And in 5 years, the traffic congestion was back to what it had been prior to the widening on I-26, the major freeway in our area.
So, you know, Jeff and I just presented the challenges, the problems within our respective silos, right? And when we sat down and as we became more friends and colleagues, we thought about, well, maybe one way to break down silos and solve some of these problems is to create a multidisciplinary course. And I know that some of the others who may be attending today have had similar ideas. We know that this isn't the only one of its kind, which is great. And hopefully what we'll be able to do is share with you today some of what the lessons that we've learned in developing this public health, physical activity, and design of the built environment course, which was ultimately designed, as I was saying earlier, to bring together students from all these multiple or variant disciplines in order to think about these problems together and try to find solutions from a public health perspective, from a transportation perspective, from an urban planning perspective, from a physical activity perspective, and gain a better understanding for how to solve those problems and how to work collaboratively from different disciplines. So ultimately, it was an attempt to break down those silos and bring people together.
And we developed a course that we're going to talk about today, but we also developed a certificate program, and we had partner institutions in the city of Charleston, in our area, that we were, that had programs that we felt that would maybe connect with this, obviously in transportation engineering at our institution, at the Medical University of South Carolina, which is maybe about 1.5 miles away from our campus, where they have a public health program. College of Charleston, maybe about 2 miles away from our campus, that has a public administration program, and a satellite branch of Clemson University that has architecture and urban planning, maybe 1.5 miles away. So geographically, we're all connected. We have similar interests in this multidisciplinary space. So we developed a certificate program and spent a lot of time beginning maybe in 2015 and 16 trying to put this program together. And these were the ones that we're hoping to draw, and courses that we would take from their programs, their existing programs, to count towards elective credits in our certificate program. And I think this was yours.
Yeah. Yeah, so now we're going to start to get into a little bit more of the content of the course, as we thought it might be a good idea to teach it. As you see on your screen, there are 12 items that are highlighted in yellow. we don't have enough time to go through everything that we went through in the class, but we will try to give treatment to these 12 particular items. And we largely used a textbook. Maybe this is a shameless plug. Maybe it's a shameful plug. I don't know. But we did publish a book last year called Physical Activity and Public Health Practice that Jeff was a contributor to, and thank you, Jeff, so much for those contributions. And there may be others. I don't know. I can't see the entire list of who's here, but for all I know, there may be some folks on this webinar who were contributing authors, and if so, thank you also for your contributions. But the purpose of this book and the gap that it filled was almost like a user's guide, a user's manual to how to design, deliver, and evaluate physical activity interventions in different settings and different populations. So, for example, if you're an urban planner and your boss comes into your office and says, you know, we really need to get more walkable communities going here. Well, you could turn to this book and it's going to help you with how to maybe design and deliver an intervention within a particular community that through which you can engage other key stakeholders and break down those silos and hopefully measure the impact that that intervention may have. And the same may be true for somebody working in a Department of Public Health whose expertise may be in child and maternal health, but you're the public health expert. So somebody comes in and says, hey, we need a physical activity intervention in schools. Go ahead, build one. So this book is designed to be a very practical guide to interventions aimed at improving physical activity and public health. Okay, so we'll charge ahead. And again, Jeff and I, the approach we're going to take here is kind of how we did in class. We felt that it was really important that both of us be in class at every class meeting. I think one of the most influential courses I ever took, when I was an undergraduate student, was a bi-disciplinary class that was taught by a professor from our psychology department and one from our political science department. And what made the class and the experience so rich was actually having them both in class at the same time. And even they would argue a little bit sometimes and bat ideas back and forth. And it made for a very rich experience. And Jeff and I wanted to try to create that as much as possible. And so the way in which we'll go about talking through these different subjects is similar to how we did it in class. So one of the items that we needed to talk about was just the relationship between physical activity and health, and the fact that there really is overwhelming evidence that physical activity improves health. We just know that. It's not really disputable. And for any of you who are trying to maintain or boost your immune function to try to fight off COVID, well, physical activity is a great way to boost your immune function. It's a great preventive tool. So I hope that you're all doing that. And, you know, even if your video is blocked here, go ahead and stand up and maybe do some jumping jacks if you want to while we're delivering this talk. But we also know that there are differences by population subgroup across race and ethnicity, gender, socioeconomic status, whether you live in an urban or suburban or rural setting. We know that there are some real differences in population levels of physical activity and health, or physical inactivity and disease, and that those health equity issues are very important for us to be thinking about as we design and maybe deliver interventions with an eye towards helping those who are the most at risk. That's largely what we're trying to do in public health. So that's what we were talking about when we were introducing the students to these relationships between physical activity and health. Jeff?
And kind of the big picture aspects that Dan is talking about, we begin to look at, like, well, how do we provide transportation infrastructure? And obviously we have a very well-established planning process. It's has a lot of federal mandates that are required to get the funding that you need to build and maintain infrastructure and to add capacity, and to understand how these decisions are made and the policy behind those, and how advocacy begins to influence policy is an important part of this, and that's really where we see some influences that have changed the traditional products of the transportation planning process, and understanding how to build coalitions and what type of case studies we could point to having been successful in making these kind of milestone jumps ahead to a transportation facility that we all want and need, for today and for the future.
Next, it was really important for, I think particularly for the students who didn't necessarily have a public health background, to understand some of the fundamental elements of public health. You see a picture down below of a child getting some water. Water, having clean drinking water, potable water, is one of those things that I think we often take for granted. But it's a defining moment in public health. We are currently in a defining moment in public health. I don't know what the outcome is going to be ultimately, but we're in one of those defining moments right now. And we often take public health for granted because we don't see it. If it's working well, we don't see it. Right now, it's not working well, and we see it, right? Every minute, almost of the day, if you wanted to turn on the news cycle, you're going to see how public health infrastructure was not set up to handle a global pandemic. So we wanted to help our students understand some of these fundamentals of public health, and that when we do it well, you don't see it. And when it's not done well, unfortunately, you do see it.
And then from the transportation and land use side, we have aspects that have worked against public health, in terms of our urban sprawl and all the causes of that. But then there is a big emerging area in neo-development, or neo-traditional development, where people want to be outside. People will pay a premium price for that. Some of the nicest communities in our city are neo-traditional new developments, or some of the, like the historical district of Charleston is very walkable and very desirable for quality of life and for not just being an automobile type of community. And how do we retrofit suburbia? How do we begin to make sure that we address environmental justice in all of this? These all have infrastructure components to them, and really are part of what should be in the transportation engineering field.
Yeah, and just as a quick story about that, just personally, I think we can all relate to the idea that we want to, it's desirable to live in an area where it's safe to be physically active. And I don't know how many of you know the area of Charleston. I happen to live in a place called Daniel Island, which is not named for me, but if you ever come visit, I'll welcome you to my island. But one of the things that drew us to living there was we drove by the school that's centrally located. It is placed right in the middle of the island, and it's a K-8 school. It's a big school, about 1,200 students. When we drove past, as we were looking at homes when we were moving here, there were no less than 400 bicycles that littered the area outside the school. And I was just blown away. And I thought that heavily influenced our decision to live where we live. So that was just speaking to Jeff's point earlier, that these are highly desirable things for many reasons. And there's an economic driver behind that as well. But moving on to some of the other critical concepts that we felt it was going to be important for everybody to understand and have a common language for were some of the concepts and methods in physical activity epidemiology, things like prevalence and incidence and case, which are things that we're now hearing about almost on a daily basis with COVID, but those may not have been terms that were part of the common vernacular 8, 12 weeks ago or a year ago. And particularly maybe in transportation or urban planning fields, maybe some of those terms are not utilized. But if you're going to be trying to do collaborative work and you're in an engineering or transportation field and you're going to be speaking to a public health expert, you may need to be able to speak their language and vice versa. So we also wanted to teach them about the difference between correlation and causation and some basic epidemiological terms. And I think most importantly, what we wanted to help our students understand was the difference between physical activity and exercise. So exercise comes underneath the umbrella of physical activity. Exercise is planned. Typically, if you were to think through what you think about when you think about exercise, you're probably thinking about going somewhere to do it, changing your clothes, sweating, maybe working hard, maybe being uncomfortable, all of which are significant barriers to participating in that behavior. Physical activity is much more broadly defined, and it certainly includes exercise, but it also includes walking your dog. It includes actively transporting yourself from home to work or from home to the grocery store or what have you. It includes gardening. It includes a number of different things. However, I think the public generally, when they think physical activity, they think of it as being synonymous with exercise. And that's problematic because there are so many more barriers to exercise than there are to being physically active. There are plenty of barriers to being physically active also, and that's where the part of where transportation systems and policy change becomes really important. But that what we're trying to do with these efforts towards a more physically active culture is that we're not trying to create a culture of marathon runners or elite athletes. We're just trying to get more of the population to be a little bit more physically active. And we want to weave physical activity into the fabric of our culture because it's really been arguably designed out of our culture. And we need to find ways to bring it back in. So those were the main points we were trying to get across in the physical activity epidemiology concepts piece of the course.
And, on the transportation side, there are a lot of initiatives that have taken hold all over the country on green modes of travel, transit-oriented development, the premiums that those can have in the real estate market, walkable communities, bike share programs we see proliferating all over, and the need to make network connections and to have networks that function and provide alternates to travel by car, which has very little physical activity, we see a lot of aspects that are developing, and this is what people want. So it really need to have the transportation network reflect the travel needs of the communities that they exist in today.
Next, we wanted to help our students understand that there are actually plans out there for increasing physical activity across the population. But we also wanted to help them understand the difference between a physical activity plan and physical activity guidelines. So we have federal guidelines for physical activity, which I alluded to earlier, that very broadly state that adults should accumulate 150 minutes per week of moderate intensity aerobic physical activity every week, or 75 minutes per week of vigorous intensity physical activity each week. And it's important, it's necessary to have guidelines, to have guideposts, and to be able to measure how many people are meeting or not meeting those guidelines. So having guidelines is certainly a necessary step in increasing population levels of physical activity, but not necessarily sufficient to make those changes happen. And that's where physical activity plans come in, because those physical activity plans start to talk about and make recommendations for the changes to policy and systems and environments that would allow more people to be more physically active and meet those guidelines. So we have a national physical activity plan. We also have states and municipalities that have developed physical activity plans based off of the National Physical Activity Plan. And if you even go to physicalactivityplan.org, which is the home site for the National Physical Activity Plan, you'll see that that plan is organized around a number of different societal sectors. Well, one of those sectors is transportation, land use, and I want to make sure I got the name right, so I wrote it down, transportation, land use, and community design. And within that sector, there are a whole series of strategies and tactics on things that we could be doing that we talk about in this class. And one of the assignments that we gave was to take an element of the National Physical Activity Plan and boil it down to some type of intervention that could be done locally here in Charleston that would have an impact on the physical activity levels of Charlestonians. Jeff?
And so obviously you can get a lot of physical activity through your day-to-day mobility, right? And this idea has been moved forward through a variety of ways, supporting active transportation, again, through the Robert Wood Johnson Foundation, dealing with access and equity. There's a big initiative that would overlap into this area as well, and the availability of data, really very broadly painted data with a broad brush, but health performance metrics on a MSA, mean statistical area basis, and the data that you can look up and make comparisons between different communities and begin to see the kind of we're not to the granular level yet, but more of just a aggregated level of physical activity that's related to transportation, that's also related to land use.
One of the critical things, going back to what we had said earlier about finding salient messages, right, particularly with policymakers, they want to see that something's having an impact, that it's making a difference. And so I know that in the transportation area, there are ways to measure usage of a particular street and measuring crashes, and it's finding the salient outcomes that are going to make a difference. And it's same is true in physical activity, and measurement of physical activity is its own sub-discipline within the physical activity field. So we wanted our students to understand that if they were going to implement some type of intervention, well, they may want to have physical activity as an outcome measure, and to be able to think through how they were going to arrive at what that measure was. Were they going to use commercially available devices, which have some limitations potentially with the validity and reliability of the data that's coming in, but they're much more globally used and much more user-friendly, and you don't have to go buy them because most people have them, as compared to maybe a research-grade accelerometer, which costs several $100s. You've got to get that out to the people who are participating in your intervention, and there may be some challenges, particularly with respect to cost, to using a research-grade device. So we wanted our students to be able to think through, and some of this is in the book as well, how do you select the right instrument to measure the right outcome? And there's no right answer. You just need to be able to think through, ideally with your collaborative partners, what you want to measure and how you're going to measure it and why you're going to measure it that way. So that's what we wanted them to understand in that section of the class. And Jeff's going to talk about health impact. I was just talking about physical activity, but Jeff's going to talk about another way to measure outcomes.
Yeah, so we've had environmental impact assessments and impact statements for a long time to form the plans that would lead to projects that would fit and meet the needs, the long-term needs of the community. And this is really being transformed into a broader context under health impact assessment. And we see the CDC involvement in this and funding of particular projects. So talking about this in the context of how do we get more physical activity and have healthier communities, and what role does infrastructure play, specifically transportation infrastructure, is a really interesting aspect for our profession and obviously for students going into the profession. And we looked at case study locations, and one that really is in our area that I think many people look to would be the Atlanta Beltline, and how what forces came together to produce that project and under the context of health impact assessment.
So, we were just talking about measurement, and measurement can happen, at a local level. But ultimately, a lot of times the government, CDC and NIH and others are looking at ways in which we can monitor health at the national level. And there are different surveillance systems that are out there. We've got one here listed as NHANES, which stands for the National Health and Nutrition Examination Survey. There's an initiative called Healthy People 2020. And both of those are efforts that are aimed at measuring health and public health in a number of different domains, and physical activity happens to be one of them. But one of the other pieces that we wanted students to understand was the difference between obesity and physical activity. And oftentimes nutrition and physical activity and obesity get lumped together. And in fact, even at CDC, it's called the Division of Nutrition, Physical Activity, and Obesity, DNPAO. And it's great. It is great that there is a division of the CDC that is specifically looking at those health behaviors, and they all are related to each other, and yet they are in some ways distinctly different. And I think one of the challenges that we have is that we oftentimes talk about obesity, and obesity is unquestionably a major public health problem that is similar to, but also different from, physical inactivity. So they're associated, and it's much easier to see, to observe obesity than it is to observe physical inactivity. So you can't necessarily point to somebody and say, hey, you look like you're not sufficiently physically active. Improving physical activity and increasing physical fitness carries its own unique health benefits that are distinctly different from changing your body weight status. My point being that it's actually, you're better off being physically fit and maybe overweight than you are being underweight and underfit. So fitness which comes through being more physically active, in and of itself, irrespective of any change in body weight status, carries a myriad of health benefits. And oftentimes, obesity, physical activity, nutrition, which are all important, but they get lumped together. And so when we're talking about maybe interventions, or we're talking about working together, and we're talking about transportation, we want to be careful, thoughtful. I don't want, not necessarily careful, but thoughtful about what it is, what are our outcome measures that we're really interested in. Are we interested in changing obesity levels, body mass index, which is one way to measure that? That's a tough thing to change. But if we're looking at just changing physical activity, which is not necessarily easy to change, but that may be the primary outcome measure that we're going to use. And so therefore we might use, a Fitbit that's going to give us somebody's steps, or how many miles they walked, or how many minutes of moderate intensity physical activity they got, versus maybe measuring some assessment of body mass index or obesity. So we wanted to help our students understand those subtle differences, and also how those different things are measured or surveilled at the national level with some of these initiatives that we have here, NHANES and Healthy People and so on.
And how to deal with bigger picture issues such as what Dan is speaking about, but then also incorporate larger societal differences. We look at demographic changes, which are having a big influence. Our transportation planning horizon is usually 20 years off in the future, and now Generation X, Generation Y, Generation Z cumulatively make up 62% of the population. We see that that a large percent, over 50% of people will live in single family households in 2025. It's one of the projections. Aging in place. Many changes in the density of cities. In Charleston, in 1960, it was simply the peninsula of Charleston, which is 8 square miles, 125,000 people lived in that space. And now we're a city of 140 square miles with 150,000 population. And some of that includes water and marsh, but it's a driving time from one side of the city to the other is 45 miles. So these are major changes that have undermined the physical fitness and public health outcomes that we want to have for our communities. And now we're just going to go on to the lessons learned, and see that we're getting some questions here. But so we ended up, even though we promoted out to all these other institutions that would brought public health students and planning students and public administration students into our class, we had it kind of laid out in 2016 to be able to have a course that had all these different students in there. We only ended up with engineering students, and engineering students were taking other engineering classes, and they did not like or weren't accustomed to such a broad context. They were taking other kind of formula-driven engineering courses, and that's kind of what they were used to. The timing, and 2 of the 4 programs were being developed in 2016, and we were ready to get all of that to work out at that point in time. But unfortunately, we couldn't solve the tuition issue. We didn't have a tuition exchange program, and so we ended up, the students wanted to come at that time, but we didn't have a way to get them here without them having to pay extra tuition. So this ended up being, one of the impediments that we faced to kind of implementing it in the broader context.
Yeah, so, and part of what that led to was just a need to recruit and connect with a more diverse body of students. It was pretty homogeneous with respect to a slant towards civil engineering students and transportation and urban planners. Public health students were really not, or public administration students, unfortunately, not really represented in the class. And I think that that was reflected a little bit in our student evaluations, which were good but not great. And I think had we had a more heterogeneous mixture of students, it would have led to a richer experience for all of them. So that was a really big takeaway, is trying to have a more heterogeneous population, and thinking, moving back from that, making sure that you've got, if you're going to do something across either different departments on your campus or across different institutions, that you give some thought to how you're going to be able to bring those different students in, because as Jeff mentioned, we ran into some bureaucratic issues with respect to how tuition was going to be paid for and so on. So if you can get across those hurdles earlier on, I think it'll lower the barrier and allow a more diverse population of students. And I think the other key lesson that we learned was that it was a lot of material, particularly for a 7-week course. Then that was probably the biggest thing that we got negative feedback on, constructive criticism, however you want to frame it, was that it was a lot. It was a lot of material in a short period of time. And so when we get into the next steps and paths forward, that's something we'll address, but there was a lot that we covered in that short period of time.
And the next steps that we're going to take, we're going to try to offer it during the regular 15-week semester, or if we have to offer it in a constrained time, then it would be we would limit the content, and also to develop and deliver for online, that we would have a greater reach, and we wouldn't be stuck with just trying to solve this, getting people out of their silos in our own geographic area. These programs, like for me, I'm a department head. I want to, fill up the classes. I don't want students to go off taking a bunch of other courses and replace the courses that we have scheduled for them to take. So so going online, I think, would be a much easier way to kind of get to the space that we want to have with the people coming from all these different areas.
Yeah, and I'll touch on the last two. I'll try to do it quickly, because another point I want to talk about. I think considering possibilities of continuing education credits and not just academic credit could be a way to bring in a more diverse group of students. And then, continue to update instructional materials as the field is rapidly changing. So COVID-19, again, is a pretty important example of how we're having to take a really hard look at our public health infrastructure. Even before COVID-19 happened, we're obviously thinking a lot about our transportation infrastructure. And so that all in the context of, again, a Transportation Reauthorization Act that's coming up, I think now is an opportune time to begin developing and delivering classes like this, because it's going to allow students to take advantage of what is called sometimes a policy window, which is when there's a very clear defining event that highlights a problem, and you see transformational policy change take place. And I think we're there, right? We are in the midst of that right now. And so if we can take advantage of that and help bring students together and disciplines together to think through how we can build better transportation, urban infrastructure to solve some of the physical activity and public health issues that we have, the opportunity is here and will be here, I think, over the next several years.
And one of the things that we did as part of the overall grant, the proposal was to conduct a survey to find out what other courses were kind of like this being taught at other institutions. And so we did have a survey. Here we list 9 institutions are teaching similar courses to this. There's been, the survey's ongoing. We've had 2 additional schools. So we would say that there's 12 altogether that we know about anyway through the study. And then we asked questions that really related to our course goals, where, I have a crazy mouse driver here. What, to the level of, on a 1 to 5 Likert scale, how thoroughly did they feel like they covered these particular topics? And more were topics related more to traditional and emerging transportation, and probably not as much on the physical activity and public health side. And we are going to issue a final report that would have all the results of this survey and much more details of like what were assignments and all that sort of stuff, the more granular detail. We just felt like in a 1-hour webinar, we weren't going to get to give you a very good representation of all the things that were covered in the course. So that will be to come, and I think that the list that's generated from this webinar would also be notified of that. So now we just have a few closing thoughts that I think that we would all be in agreement on, and this really comes from some of the active living research, just things that are tangible measures of the fact that we have sidewalks. It leads to more physical activity. If we have traffic calming and less speed and lower speed differentials between automobiles and other more active modes of travel, that we have measurable benefits from that, and we can point to communities where these things have been of value. Yeah,
and this is a similar wonderful infographic from active living research, and I won't go into the details here because I do want to leave a few minutes for Q&A, but just feel free as you either look at this slide now or look at it later on with the recorded version of this. There's some great stats that you can use here, but I think maybe we'll pause now. I know we have one more slide here, Jeff, but looking at where we're at with the clock, maybe we can take some questions now.
All right, and then there's this has been posted in the chat search survey to give feedback, and then the last one is like what some of the upcoming webinars are. But we're happy to answer any questions anybody has. I think that if you ask anything in the chat, we had some questions really about the content of the course, and then you will be able to see that in the final report that'll be issued later this summer. And probably finalized by the early fall.
Great, thank you so much. This is Ondine with the Stride Center. We do have a couple of questions we'll try to fit in within the last few minutes. The first was, can you discuss the assignments you give the students?
So most of the assignments were team assignments, group assignments of maybe, we had a relatively small class. There was usually like 2 students, and what we had in mind would be like an engineering student and a public health student. But when we ended up with only engineers, then they really had more of an engineering slant to them. But it was to go and look at where interventions could be developed or implemented in our community, which they were familiar with, and how would we begin to measure some of the beneficial outcomes from these interventions. And we had a 7-week course, so we had a series of rolling assignments. We had a midterm that had a lot of terminology questions in there. And we had a final exam that was a presentation to the city's committee on the mayor's committee on public health. I don't know, what's the name of that committee, Dan?
Yeah, the mayor's council on health and wellness. So we had representatives from that committee come in and actually be presented to, and they were part of the evaluation of the students' final presentations on how they would go about designing and delivering a transportation-based physical activity intervention.
Great. For those of you who are still on the webinar, if you can go to the chat box, there is a link to a very brief survey that we'd ask everybody to provide feedback on future webinars that we can do. We have another question. Do you touch on other public health issues other than physical activity, such as air pollution, safety, or stress?
It's a great question. The answer is we did a little bit when we talked about some of the foundations of public health and some of the elements of public health. When it came to assignments and really getting into the meat of the course, we were really focused on physical activity. Not to say that those issues aren't important and wouldn't be benefited by a physical activity and transportation-based intervention. So those are very important issues. I think we were up against the clock in terms of the amount of content we could deliver in that short period of time, which, as we learned, was even a little bit too much. But maybe over a 16-week course, there'd be an opportunity to talk about other elements of public health that could be impacted by better transportation and urban planning. Great question.
Great. We have a couple of people who've expressed interest in more information on the curriculum and ways that they might be able to do a similar curriculum. Would they follow up with you personally? We will post your final report on the Stride Center website when it's available. If there are ways that they can contact you also directly, that would be great. Maybe we have your emails in the title slide. I can't remember if we do.
I don't think we put that in there, but you can find us at the Citadel, or easy to find.
We can. You can also put your emails in the chat box if people are interested. So that's great. We have another question, probably the last one. What other strategies did you consider to advertise to students in other departments?
Yeah, I put a lot of energy into this, and it mostly was going to the heads of those departments, going to the institutions and starting from the top down. And 2 of the programs were kind of in the building mode. So they were really looking for classes and courses, and they loved this idea, but that was in 2016. And then we weren't able to solve the tuition problem until we got the Stride grant. And then we had some free tuitions to give out. So we didn't have to worry about exchanges between institutions. And we developed flyers. We went to Public Health Day at the Medical University. We met with people directly at the other institutions and established partnerships. But those partnerships have like a shelf life, because the people we met with in 2016, they weren't the same people that were in charge in 2018 and 19. There had been some leadership transition. So it didn't translate. Now the programs were really more established, and they wanted to protect their curriculum, and it was much more difficult. They said they covered these things in their classes, which, it kind of didn't seem like a really great answer to me, And the opportunities to collaborate had changed, unfortunately.